All right, so your boobs hurt. You cried during a commercial or during a song. You're exhausted. Does this mean you're pregnant? Maybe. All right, or is it just progesterone? That is the question. So today we're going to talk about implantation, first signs of pregnancy, all these things that people are usually like Googling like crazy or on Reddit, going down all kinds of loopholes, rabbit holes, whatever they're called. So let's talk about it. Let's dive in. So I'm Katie. I'm a nurse practitioner. I'm a fertility consultant, and I help people get pregnant faster and to just navigate fertility and fertility in general. So let's dive in. So what is implantation? So a couple of things that sometimes people maybe misunderstand. So when egg and sperm meet, that is not technically a pregnancy yet, okay? So we have had some combination of the egg and the sperm, which is great. That's the first step, okay? But now this little embryo has a journey. It has a little journey to go on, and it has to travel down the fallopian tube and implant into the lining of the uterus, okay? So what this looks like is ovulation, fertilization, embryo growth and development, then implantation. Wow. Then once the embryo is implanted, we will start seeing HCG production. HCG is what your pregnancy tests are looking for. They're marking, is it there or is it not? And a lot of times people will notice, like when the HCG levels are stronger or higher, that they will see a more colorful or a darkened line on the pregnancy test. So sometimes people will notice a little bit of a line, and then the next day they test, it's a little darker, the next test is a little darker, etc. And what that tells us is that the HCG levels are just becoming more concentrated, which are good. Now, it's not going to give us a numerical number. Now, if you went to your OBGYN or your PCP or a lab and you had your HCG levels drawn, what you're going to see is that HCG level should be doubling daily in the beginning. And so that is another way that people can confirm that they are pregnant, and also in the beginning kind of get an understanding of where you may be in your pregnancy. If you are not having regular cycles, you don't keep up with things, it kind of can give us a little bit of a prediction. Not great, but a little bit of some information. So implantation usually occurs about 6 to 10 days after you've ovulated. So with many pregnancies, implantation is usually going to be right down days 8 and 9, okay? So the next question sometimes people will ask or be Googling is, can I feel implantation? Maybe. Most women can definitely not kind of feel implantation. I have some people and some clients who are really in tune with their body, and they're like, boom, I knew I was pregnant. And maybe they did. Maybe they just had an intuition. Maybe they are more in touch with their bodies. I don't know. But some commonly reported symptoms that people will notice for implantation are mild cramping, light spotting, fatigue, breast tenderness. But here's the thing. Progesterone causes all of those exact same symptoms. So it's difficult sometimes to tease apart, is this just that my progesterone is doing what it's supposed to do in the second half of my cycle, or am I pregnant? And guess what? You can't tell the difference. So if you're kind of wondering, that's normal. And it's hard to know, especially when you're in this, like, if you're paying attention enough, you're kind of in this mental game of like, am I pregnant? Am I not? So the fact that you're, watching this, if you are trying to spot all of your symptoms and Google them and determine, I want to know the second that I'm pregnant, welcome to the club of overly, I guess it's not overly because I'm in this category, overly anxious and controlling and trying to know just the moment that it happens so that you can plan your trajectory, right? So the biggest mistake that I see people doing is that they test too early and then they get disappointed. So really, day 10 post-ovulation is kind of most guaranteed, most reliable to be able to get a positive pregnancy test, or really days 12 through 14 are going to be more reliable. So you can start testing as early as day 10 after ovulation. So before, like when your body implants though, you're not going to be able to like take a test right then, right? So it has to, your body has to implant and then start producing enough HCG that is then being excreted through the urine. So if we don't have HCG, we're not going to see a positive pregnancy test, okay? So the earliest true signs of pregnancy are not nausea. It's going to be the rising HCG. some symptoms, again, that you may feel: fatigue, breast tenderness, cramping, increased urination, food aversions. But a lot of times people aren't going to notice that until closer to week 6 or after that they have had a positive pregnancy test. So if you're tracking ovulation with Mira, Anito, LH strips, basal body temperature, timing matters, we just need to kind of continue to pay attention to what was your ovulation date. And so if you do get a negative test on day 8 or 9 after ovulation, don't let that get you down. I've got some people that are like, I have to take a test every day. It makes me feel good. Like, let me do it. I want to kind of watch and trend. I've got other people that are like, this is driving me crazy. So just don't test until post ovulation day 10. And you kind of want to look at your cycle. Like, when are you typically ovulating? When do you think that you're ovulating? If you're paying this close attention, you probably have some sort of estimate. And so you just want to kind of give it a little bit of time and don't give up hope. Okay. So a lot of times what I tell my clients is that imagine implantation is someone turning on the faucet. The pregnancy test is not detecting that the faucet is being turned on. It is detecting that the water levels are rising in the sink, okay? And that takes a little bit of time for it to get to levels high enough for them to be able to test. So if you're in your 2-week wait right now, it's hard. I see you. Try not to analyze every cramp, every twinge, every gas pain, every symptom, and focus on what you can control, which is taking care of yourself. And remember that a negative test is only definitive when it is taken at the right time, okay? So I hope this was helpful. I understand the Googling. I understand the rabbit holes. But you just have to wait until you see that HCG test, or HCG is positive and giving you that test. But I hope that helps you kind of understand the anatomy, because it can be confusing, and what it actually takes for you to get there. Cool. Anyways, see you next time. If you've got topics you want to discuss or learn more about, drop it in the comments below, and we'll try to make another vlog for it.